So, the NHS facing disruption on what seems to be an unprecedented scale this winter, with nurses set to stage their first national strike in that row over pay. The walkout could start before Christmas, with chemotherapy appointments and children's services among the treatments expected to be hit. There's already a sharp rise in waiting times for cancer therapy. And the latest overall NHS waiting figures released this morning show an ever-worsening crisis. 7.1 million people now on the waiting lists. Ambulances taking more than an hour to answer emergency calls instead of the expected 18 minutes. And those waiting at A&E for more than 12 hours, well, that figure up another 34% on last month. Can it get any worse? And how can the government make it all better? Well, joining us now, our former Secretary of State for Health, Stephen Dorrell. Mr. Dorrell, thank you very much indeed for joining us. It's quite an in-tray for Steve Barclay, the new Health Secretary. First of all, on this issue of the nurses striking, what action would you be taking, given that, of course, a lot of people are saying the 17% figure they've suggested is really not attainable?
Yeah, there's no argument that 17% is a very high number. I agree with that. I think that the danger for ministers in these circumstances is to be seen to be grandstanding rather than engaging, as Chris Heaton-Harris, in fairness, the Northern Ireland Secretary, was saying on the clip you played a few moments ago. He was saying it's important that the talking continues, and I do agree with that. I don't believe there's a nurse within the RCN that actually wants to go on strike. I think that there's a challenge here, both for the RCN leadership, actually, and also for ministers to commit to a search for a settlement that doesn't involve nurses withdrawing labour and clearly making waiting lists and other NHS issues even more pressing than they already are.
Yeah, and what should those talks be about? Because Matthew Taylor, the Chief Executive of the NHS Confederation, is saying this is about more than pay, and clearly the nurses are pointing to this. I think it's 47,500 vacancies in nursing staff.
Well, absolutely. There's no point when ministers say, "Oh, it's about more than pay." They're sometimes heard to be saying, making excuses in a sense for trying to avoid the issue of pay. I think it's important in these kind of negotiations that nurses' representatives in the RCN, and more importantly, nurses themselves, see ministers addressing the issue head on. There is an issue about pay, but there has to be other issues on the table as well. And of course, a key element of that is recruiting into the health service sufficient new nurses, either attracting back people who've left the health service or bringing new nursing staff into the health service in order to fill those vacancies. And there's an important caveat on that too, if I may say, which is that you don't solve any problems in the health and care system as a whole if the only thing that the NHS does is to recruit nurses out of social care, which would make the problems in social care even worse and therefore more workload for the health service.
Right. A tricky topic for the Tory government to wrestle with. What should be done on migration in terms of trying to attract foreign staff to come in, some of whom may already have training in other health services?
Well, indeed, and indeed many of whom have experience of having worked in our own NHS. I was interested that Lord Wolfson's reported on the news this morning as saying that in the retail sector, which obviously is a big retailer he's interested in, the government needs to be more flexible in terms of allowing people to come and work in retail. Well, if that's true of allowing people to come and work in retail, for goodness sake, isn't it even more true that there should be flexibility around people who are able and willing to come and work in the health service, of course, with proper qualifications and so forth? So
you do share that view then?
I absolutely do share that view. I left the Tory party as a result of its volte-face on Brexit and so forth. I think that we have not yet worked out how we can earn our living and deliver growth and fulfil our public service obligations and so forth against the background of an immigration policy that frankly doesn't support any of those objectives.
Right. Now, as a former health secretary, looking at these statistics that have come out today, which are pretty frightening, 7.1 million on the waiting list overall, those waiting more than 12 hours in A&E, up 34% on last month. How would you triage the health service for this winter, given the problems that are building up?
Well, and this is where it's of course true. It's about more than simply paying nurses more or paying all NHS staff more. It is also about how you use the resources available to the health service as effectively as possible. And I've already made the point. One of the obvious issues here is the relationship between the NHS and social care. That's often said to be about people being able, the NHS hospitals being able to discharge people into social care. That's a key element of it, for sure. But we need to remember that for every delayed discharge, i.e. somebody who could leave hospital but can't because you can't find place for them in social care, for every delayed discharge, there are 4 avoidable admissions into hospital. If we had properly structured social care, we would reduce the demand both on our GP surgeries and primary care, but also on the hospitals. So it's about thinking this system as a whole rather than individual bits of it.
Yeah, systemic approach to have a joined-up system, as people have talked about. Mr. Dorrell, thank you very much indeed for joining us. Great pleasure to have you here on GB News and hearing your views. And let's hope it is going to be a rather healthier position for the NHS. Thanks very much indeed.